Most people over 65 are told to get more checkups, more scans, and more tests. But here is the uncomfortable truth. Some medical checkups can quietly lead you into worry, unnecessary treatment, and decisions your body may never have needed. And that is why, if I were over 65, there are 4 checkups I would never get automatically. Not because checkups are bad, not because doctors should be avoided, and not because your health no longer matters after 65. It is the opposite. Your health matters so much that every test should have a clear reason, a clear benefit, and a clear plan for what happens next. Because after 65, the question is not just, can this test find something? The better question is, if this test finds something, will it actually help me live better, move better, sleep better, think clearly, stay independent, or avoid harm? By the end of this video, you will understand 4 medical checkups that many older adults request or accept without asking enough questions. You will learn why they can sometimes do more harm than good, when they may still be necessary, what warning signs you should never ignore, and what smarter questions to ask your doctor before agreeing to any test. Hi everyone, I'm Dr. Sophia Adams, and welcome back to the channel. Here, we take the health concerns many older adults are told to just live with and explain what may really be happening inside the body using clear science, real-life examples, and practical steps you can use in everyday life. Let me tell you about a senior I'll call Robert. Robert was 72 years old. He lived alone, still drove himself to church, walked around the neighborhood most evenings, and took pride in staying on top of his health. Every year, he asked for everything to be checked. Blood work, scans, heart checks, cancer checks, anything that sounded preventive. On the surface, that sounds responsible. But over time, something changed. Robert became more anxious after every appointment. One test found a tiny spot on his kidney. Another found a small artery narrowing that was not causing symptoms. Another blood test came back slightly outside the normal range. Then came more appointments, more repeat scans, more waiting, more worry, and more nights lying awake, wondering if something serious was hiding inside him. He was not getting healthier, he was getting frightened. And here is the part many seniors miss. A test can be medically impressive and still not be useful for you. Hold that thought, because it will matter throughout this video. Before I explain the 4 checkups, answer this for yourself. Have you ever had a test done simply because you wanted peace of mind, but the result left you more worried than before? If you are comfortable, write yes or no in the comments. And if it happened to you, was it a scan, a blood test, a heart test, or a cancer screening? Now let's correct the first big misconception. Many seniors believe that more testing always means better care. That is not always true. Good care is not about checking everything. Good care is about checking the right thing at the right time for the right person with a plan that makes sense. A medical test is like turning on a flashlight in a dark room. Sometimes it helps you see a real danger, but sometimes it shines on dust, shadows, and harmless marks that were never going to hurt you. Once you see them, it becomes very hard to ignore them. That is how unnecessary testing can lead to a chain reaction. One small finding leads to another test leads to a biopsy leads to a complication, or a harmless abnormality leads to years of fear. So let's talk about the 4 checkups I would never get automatically after 65. Number 1, I would never get a full body scan just to check everything. This includes full body CT scans, whole body MRI scans, and expensive wellness scans marketed as early disease detection. I understand why they are tempting. The advertisement sounds comforting. It may say, find disease before symptoms appear, or see what is happening inside your body, or take control of your health. For a senior who has lost a friend to cancer, watched a spouse decline suddenly, or lived through years of health uncertainty, that kind of promise can feel powerful. But here is the problem. A scan is not wisdom. A scan is an image, and images often find things that are not dangerous. The body changes with age. Small cysts, tiny nodules, enlarged areas, old scars, minor artery changes, and harmless spots become more common as we get older. Many of these findings are not life-threatening, but once they are written in a report, they can become emotionally heavy. According to the U.S. Food and Drug Administration, whole body CT screening in people without symptoms can produce results that are normal, unclear, or abnormal in ways that do not always mean disease. The FDA warns that every test can give incorrect results in some cases, and CT scans also involve radiation exposure. That does not mean CT scans are bad. A CT scan can be life-saving when there is a strong reason. Chest pain, severe abdominal pain, stroke symptoms, cancer follow-up, trauma, unexplained weight loss, a doctor's specific concern, but a full-body scan without symptoms is different. It is like sending a search party into a forest without knowing what you are looking for. They may find something, but finding something is not the same as saving your life. For seniors, the hidden danger is overdiagnosis. Overdiagnosis means a test finds a condition that would never have caused symptoms or shortened your life, but now it pulls you into treatment, worry, and medical procedures. Imagine finding a tiny spot on the lung that is probably harmless. Now you need another scan in 3 months, then another, then maybe a biopsy. You spend months worrying, even though the original spot may never have affected you. This is why I would not get a full body scan just because I am over 65. Instead, I would ask a doctor one question. What symptom, risk factor, or medical decision is this scan meant to answer? If there is no clear answer, I would pause. Number two, I would never get a carotid artery ultrasound as a casual stroke prevention check if I had no symptoms. The carotid arteries are the large blood vessels in your neck that carry blood to your brain. When people hear that these arteries can narrow, they naturally become afraid of stroke. And that fear is understandable. Stroke is one of the biggest worries for older adults. It can affect speech, walking, memory, swallowing, independence, and the ability to live alone. So when someone offers a quick neck scan to check for blockage, it sounds sensible. But for people without symptoms, routine screening for carotid artery narrowing is not recommended by the U.S. Preventive Services Task Force. The reason is important. In adults without symptoms, the harms of screening can outweigh the benefits. Why? Because mild narrowing is common with age, and not every narrowing needs surgery. If a scan finds something borderline, it may lead to more imaging, more specialist visits, anxiety, and sometimes procedures that carry their own risks. Surgery or procedures on arteries are not small decisions, especially after 65. Your blood vessels are like flexible pipes. Over time, some plaque can build up. But the question is not simply, is there plaque? The better question is this plaque causing symptoms? And would treating it reduce my risk more than good medical care would? For many seniors, the strongest stroke prevention steps are not flashy. They are blood pressure control, cholesterol management when appropriate, diabetes control, not smoking, safe movement, medication review, and knowing the warning signs of a stroke. And those warning signs matter: face drooping, arm weakness, speech trouble, sudden vision loss, sudden severe dizziness with trouble walking, sudden confusion, sudden severe headache. If those happen, that is not the time to debate screening. That is the time to seek emergency help. But if you are feeling well and someone offers a carotid scan at a health fair, pharmacy event, or wellness package, I would not rush into it. I would ask, have I had stroke symptoms, a mini stroke, or a medical reason for this test? If the answer is no, I would be careful. Number three, I would never get a PSA test automatically after 70 without a careful conversation. This one is for men, but women should also listen because you may have a husband, father, brother, or friend who needs to understand this. PSA stands for prostate-specific antigen. It is a blood test that can be used in prostate cancer screening. Many men believe PSA is a simple cancer test, but it is not that simple. A high PSA can be caused by prostate cancer, but it can also be caused by an enlarged prostate, inflammation, infection, recent procedures, or other non-cancer reasons. This is where many older men become trapped in fear. A number rises. The mind immediately thinks cancer. Then comes repeat testing, imaging, biopsy, and waiting. Sometimes a slow-growing cancer is found, but not every prostate cancer grows quickly. Some prostate cancers in older men may never cause symptoms during their lifetime. The U.S. Preventive Services Task Force recommends that men aged 55 to 69 make an individual decision about PSA screening after talking with their clinician. But for men 70 and older, the USPSTF recommends against routine PSA-based screening. That word routine is important. It does not mean every man over 70 should ignore urinary symptoms. It does not mean men with a strong family history should never talk about prostate risk. It does not mean a doctor can never order PSA for a specific reason. It means automatic screening after 70 can create more harm than benefit for many men. The potential harms include false alarms, biopsies, infection, bleeding, anxiety, diagnosis of slow-growing cancer, and treatment side effects such as urinary problems and sexual problems. And for a senior man who is already managing blood pressure, diabetes, arthritis, sleep problems, or heart disease, these side effects can seriously affect quality of life. So here is the deeper truth. The goal is not to find every tiny cancer cell. The goal is to find disease that would likely harm you and treat it in a way that improves your life. That is a very different standard. Before getting a PSA test after 70, I would ask, if this test is abnormal, what would we do next? Would I be healthy enough and willing to go through biopsy or treatment? How would this result change my care? If the answer is unclear, the test may not give peace. It may create a road you did not intend to walk. If this is already helping you think about your health more clearly, please tap the like button. It tells YouTube to show this video to more seniors who may be quietly struggling with the same confusion. And if you have ever been offered a test without fully understanding why, write your experience in the comments. I read the comments carefully because they help me know what health concerns to explain next. Also, subscribe to the channel so you do not miss the next senior health warning sign we break down together. Number 4. I would never get routine cervical cancer screening after 65 if I had adequate prior screening and I was not high risk. This one is for women, but again, everyone should understand it because many adult children help older parents with appointments. For many women, pap tests were a normal part of life for decades. So when they turn 65, stopping the test can feel strange. Some women even feel unsafe without it, but medical guidance is clear for many women. The U.S. Preventive Services Task Force recommends against cervical cancer screening in women older than 65 who have had adequate prior screening and are not otherwise at high risk for cervical cancer. Why? Because if a woman has been properly screened over the years and has no high-risk history, the chance of benefit becomes low, while the chance of harm from unnecessary follow-up becomes more important. A test can find minor cell changes that may never become dangerous, but those findings can lead to repeat testing, procedures, discomfort, bleeding, anxiety, and worry. This does not apply to every woman. If you have a history of cervical cancer, serious precancerous changes, a weakened immune system, DES exposure, or inadequate previous screening, your doctor may recommend continued screening. If you have symptoms such as bleeding after menopause, pelvic pain, unusual discharge, or bleeding after sex, that is not routine screening anymore. That is a symptom that needs medical evaluation. This is the key difference. Routine screening is done when you have no symptoms. Diagnostic evaluation is done because something has changed. Never confuse the two. If something is wrong, speak up. But if you are over 65, low risk, and adequately screened, getting pap tests automatically may not be the best use of your medical time or emotional energy. Now let's go back to Robert. Robert's turning point came when his doctor finally asked a different question. Instead of asking, "What else can we test?" the doctor asked, "What are we trying to protect?" Robert said he wanted to stay independent, keep walking, avoid stroke, avoid falls, and stop worrying so much. So they shifted his care. They focused on his blood pressure. They reviewed his medications. They checked whether any medicine could increase dizziness. They discussed colon cancer screening based on his age and past results. They reviewed vaccines. They talked about sleep, balance, leg strength, and nutrition. They made a plan for what symptoms should trigger urgent care. And slowly, Robert stopped chasing every possible abnormality. He still got medical care, but it became targeted care. That is the lesson. After 65, the best healthcare is not the most aggressive healthcare. It is the most thoughtful healthcare. Now, before I give you the practical steps, I need to say this clearly because your safety matters more than anything in this video. Do not use this video as a reason to skip medical care that your doctor has recommended for a clear reason. Call your doctor or seek urgent medical help if you have chest pain, sudden weakness, sudden trouble speaking, severe shortness of breath, fainting, blood in your stool, black stools, unexplained weight loss, new confusion, sudden severe headache, new bleeding after menopause, severe abdominal pain, a new breast lump, worsening urinary symptoms, or any symptom that feels sudden, severe, or unusual for you. If you already have cancer, heart disease, diabetes, kidney disease, stroke history, immune problems, or a strong family history of certain diseases, your screening plan may be different. And if you are taking prescription medication, do not stop it because of anything in this video. Speak with your doctor or pharmacist first. This video is educational. It does not replace personal medical advice. So what should you do instead of simply saying yes to every test? Here is a safer action plan. Step 1. Ask what problem the test is trying to solve. Before any scan, blood test, or screening, ask, what are we looking for and why does it matter for me? This one question can protect you from vague testing. If the answer is just to check everything, ask for more detail. Step 2. Ask what happens if the result is abnormal. This is the question many people forget. A test is not just a test. It is the beginning of a path. Ask, if this comes back abnormal, what is the next step? Another test? A biopsy? Surgery? Medication? Watching and waiting? If you would not want the next step, you need to know that before the first test. Step 3. Separate screening from symptoms. Screening is for people without symptoms. Symptoms need evaluation. If you are having pain, bleeding, weakness, dizziness, unexplained weight loss, or new changes, do not dismiss them by saying, I am too old for screening. That is not screening anymore. That is a medical concern. Step 4. Focus on checkups that have clear value after 65. Blood pressure checks matter. Medication reviews matter. Fall risk assessment matters. Vision and hearing checks can matter. Diabetes monitoring matters if you have diabetes or risk factors. Cholesterol discussions may matter based on your heart risk. Bone density screening is recommended for women 65 and older. Colorectal cancer screening is recommended through age 75 for many adults, and after that, it becomes more individualized. These are not glamorous, but they often protect real independence. Step 5. Bring your medication list to every appointment. Many symptoms that seniors fear are caused or worsened by medications: dizziness, fatigue, constipation, confusion, dry mouth, poor sleep, low blood pressure, unsteady walking. A simple medication review can sometimes do more good than an expensive scan. Step 6. Choose shared decision making. That means you and your healthcare professional talk together about your age, health conditions, family history, life expectancy, values, fears, and what outcomes matter most to you. Some people want every possible test. Some people want fewer procedures and more comfort. Some people want aggressive treatment if needed. Some people want to avoid anything that could reduce their quality of life. There is no shame in knowing your values. Now let's talk about the emotional side. Many seniors are tired of being dismissed. You mention fatigue, and someone says, you are just getting older. You mention pain, and someone says, that is normal at your age. You mention forgetfulness, and someone makes a joke. So when a test is offered, it can feel like proof that someone is finally taking you seriously. I understand that, but being taken seriously does not always mean getting more tests. Sometimes it means getting better questions. It means a doctor asks when the symptom started, what makes it worse, what medications you take, how you sleep, whether you have fallen, whether your appetite changed, whether your mood has shifted, and what you are afraid of. You are not weak for wanting answers. You are not foolish for wanting peace of mind. But peace of mind should not come from testing everything. It should come from understanding your body and making wise choices. So here is the core lesson. After 65, I would not automatically get a full body scan without symptoms. I would not casually get a carotid artery ultrasound if I had no stroke symptoms or medical reason. I would not get PSA screening after 70 without a careful conversation. And I would not get routine cervical cancer screening after 65 if I had adequate prior screening and no high risk history. But I would absolutely pay attention to symptoms. I would absolutely keep regular appointments. I would absolutely review medications. I would absolutely monitor blood pressure, balance, mood, sleep, memory, and strength. And I would absolutely ask better questions before agreeing to any test, because your body rarely changes for no reason. If something keeps happening, especially after 65, it deserves attention, understanding, and the right kind of care. Not panic, not guessing, not endless testing. The right kind of care. If this video helped you understand your body a little better today, please hit the like button. It helps this information reach more seniors who may be quietly dealing with the same concern. Tell me in the comments if you have ever had a test that led to more worry than answers, and whether it was a scan, blood test, heart test, or cancer screening. Subscribe and turn on notifications because every week, Dr. Sophia Adams breaks down senior health concerns in a calm, practical, and easy to understand way. And if you want to learn the next warning sign your body may be giving you, watch the video on your screen now.